Welcome to today's Explainer. We are jumping right into a super fascinating intersection of physics and human biology, the restorative power of aquatic therapy for women. And right off the bat, I want you to completely rethink your definition of a pool. We aren't talking about a casual afternoon swim or just treading water for cardio. We're talking about a highly specialized, anti-gravity medical environment.
It brings up a really profound question. How exactly are you supposed to build strength when just standing up hurts? Gravity is relentless. If you're dealing with severe arthritis, or recovering from a joint replacement, or managing osteoporosis, the sheer weight of your own body can create this agonizing barrier to rehabilitation. You absolutely need to move to heal, but moving is exactly what causes the pain. It's a vicious cycle, and it leaves so many patients feeling totally trapped.
So, here's our roadmap for today. First, escaping gravity and pain. Second, the physics of aquatic healing. Third, targeted relief for women. Fourth, building balance without fear. And finally, protocols and necessary precautions.
Let's start with Section 1, Escaping Gravity and Pain.
When you immerse yourself in chest-deep water, your effective body weight drops by a massive 60 to 90%. Just imagine instantly taking off a heavy backpack that weighs almost as much as you do. This incredible power of buoyancy means that joints that simply cannot bear weight on land are suddenly freed. It allows for full, pain-free ranges of motion that would be literally impossible just a few feet away on the pool deck.
The crucial thing to understand is how this environment actively shuts down pain. Sure, the reduced gravitational load is a massive factor, but it's also the temperature. Therapy pools use warm water, which causes thermal vasodilation, which is essentially just a fancy way of saying it opens up your blood vessels to improve flow and relax muscle spasms. Plus, the constant, gentle sensation of the water surrounding you creates what's called sensory gating. Basically, the soothing feeling of the water crowds out the pain signals trying to reach your brain, which provides immense relief for conditions like severe arthritis.
Moving right along to Section 2, the physics of aquatic healing.
There are three primary forces acting on your body in the water. We just touched on buoyancy, which safely reduces your joint load. But then we have hydrostatic pressure, which actively reduces edema or swelling and can even improve circulation and lower your blood pressure. And finally, we have resistance. The water isn't just holding you up, it's pushing back from every single angle, giving you a complete 360-degree field of resistance.
Let's actually isolate hydrostatic pressure for a second, because it is an absolute game changer. By definition, this is the uniform compression that water exerts on your submerged tissues. Think of it like wearing a perfectly fitted, full-body compression garment. This pressure physically squeezes fluid out of swollen tissues and pushes it back into your circulatory system. It's one of the only clinical settings in the world where you can simultaneously do cardiovascular conditioning while actively reducing bodily swelling.
And then there's the resistance factor. Water drag actually builds incredible strength without you ever needing to pick up a single free weight. It feels totally counterintuitive if you're used to a traditional gym. Because water is roughly 800 times denser than air, every single movement you make meets resistance. And here is the genius part. That resistance is strictly proportional to your movement speed. Move slowly, and the resistance is gentle. Push hard, and the water pushes back hard. Your muscles get an intense workout, but thanks to buoyancy, your skeletal system isn't bearing the brunt of the load.
Which brings us to Section 3, Targeted Relief for Women.
The clinical evidence strongly supports aquatic therapy for a huge array of women's health conditions. For women recovering from a total knee or hip replacement, it's an amazing, safe haven for early rehab. It's incredibly effective for managing osteoporosis and handling the daily grind of rheumatoid and osteoarthritis. With specialized protocols, it's even used to treat pelvic floor dysfunction. But two of the most fascinating applications relate to breast cancer recovery and chronic pain.
It's wild how the exact same physics solve totally different problems at the same time. For breast cancer recovery, women often suffer from lymphedema, which is severe swelling in the arms. That hydrostatic pressure we talked about, it acts directly to reduce that peripheral edema. On the flip side, for postmenopausal women dealing with fibromyalgia or widespread musculoskeletal pain, the water acts a bit differently. Targeted warm water hydrotherapy, specifically kept between 33 and 35 degrees Celsius, consistently reduces pain scores and actually improves sleep quality by calming the entire nervous system.
Let's dive into Section 4, Building Balance Without Fear.
If you have osteoporosis or you're recovering from a major surgery, the fear of falling is very real, and let's be honest, entirely justified. In land-based balance training, a high fear of falling severely limits your progress, because a simple stumble carries a massive fracture risk. But in water-based training, that risk drops to essentially zero.
A stumble in a chest-deep therapy pool carries absolutely no fracture risk because the water simply catches you. It completely transforms the pool into a psychological safe haven.
And because that fear is eliminated, physiotherapists can push patients much further. They can safely challenge your proprioception, which is your body's awareness of where it is in space, along with your vestibular system. You eliminate the fear, you do the hard work, and the results are stunning. The evidence shows that this weightless training translates directly to highly measurable improvements in real-world land-based balance in just a 6 to 8 week program.
Finally, Section 5, Protocols and Necessary Precautions.
So what does a typical clinical prescription actually look like? Well, programs generally run for 3 sessions per week, with each session lasting about 30 to 45 minutes. The environment is strictly controlled. A general rehabilitation pool is maintained at 30 to 34 degrees Celsius, while a fibromyalgia-specific pool runs just a bit warmer, at 33 to 35 degrees. And crucially, this should be supervised by a physiotherapist. These exercises are meticulously dosed and monitored, exactly like a medication.
And because it's treated like a medication, an individual risk assessment is strictly required before you ever step foot in the water. The immense physical forces we've been discussing, the hydrostatic pressure, the thermal vasodilation, they mean that while the water is profoundly healing for most, it demands deep clinical respect to ensure absolute patient safety.
Because of those forces, certain conditions require extreme caution or will prevent entry entirely. For instance, a patient cannot participate if they have open wounds or uncontrolled urinary incontinence, primarily for infection control and sanitation reasons. Additionally, because that amazing hydrostatic pressure physically pushes fluid back into your central circulation, it makes your heart work differently. So women with certain cardiac conditions absolutely have to be heavily screened and potentially excluded to prevent overloading their cardiovascular system.
We've explored the incredible physics of buoyancy, the full-body compression of hydrostatic pressure, and the brilliant use of water drag to rebuild strength. So I want to leave you with this final thought. If water can literally remove the weight of the world from your joints, what could it give back to your life? Thank you so much for joining me for today's explainer, and keep questioning the science of how we heal.